He would tell me when I would do like walking lunges, your knee is going to the inside. My name is Mary Doctor. I have a total knee replacement.
I've known Mary for over 20 years. She first came to see me after she had a knee injury while on one of her hikes.
I could not get out of bed. I didn't want to be limited to not being able to hike when we traveled.
Despite a specific injury, this was a knee that was progressively wearing out.
I was astonished to find out I was bone on bone in my right knee.
Her pain progressed to the point that interfered with her lifestyle, and we decided to perform a knee replacement.
He just talked me through it, told me where the problem was, and I said, all right, I needed time to adjust. I remember when Dr. Maitra told me, because he knows me, he said, you think you're going to breeze through this? This is not a hip. My questions have always been really welcomed by him.
There is art in creating that balance, because the knee, not only does it bend and straighten, it also glides forward and backward. So we've got to match that up with the patient-specific parameters to provide a stable component that's well aligned, that moves the way the patient's knee moves, so that they have less pain and able to do their activities. So a lot of physical therapy on a regular, consistent basis.
I signed up for physical therapy every day. Not only did I follow what he told me to do, I stayed with physical therapy, and we still do it to this day, 2 years later.
A knee replacement will allow them to return their current level of function more comfortably. So they can walk, they can run errands, they can perform housework, take care of grandkids, and participate in their physical fitness and sports activities.
I have the cemented Sigma knee with the AOX poly. The knee is fabulous. It's fabulous. I still leg press my 360 pounds. I still do what I need to do. It's about maintaining your life and being able to move forward, and don't screw everything else up because you don't want to get it done.
Hopefully we are impacting patients' lives to either improve their function or improve their pain or improve both. What I look for in patients is a smile on their face when they come back to see me for their follow-up appointments.